Hi, this is Dr. Jason Tripp. I'm a chiropractor and naturopath right here in Hermitage. Today we're talking about hand pain or carpal tunnel syndrome. So a lot of people come to me and they say, well, I have carpal tunnel. And when I do the exam, it's not carpal tunnel, but it's a different type of problem in the hand. Carpal tunnel is specifically for that median nerve, and it goes into the palm of the hand like this. Now, if you have other hand pain, that doesn't mean this video won't work for you. We're going to be talking about hand pain. We're going to be talking about where it comes from and what have you. I will tell you, if you have hand pain, I want to kind of have a dialogue here. So put in the comment section, yes, that's me. I have hand pain, or I have carpal tunnel. Like, name what it is. If you know what you have, just go ahead and name it. So yeah, I have carpal tunnel. And that way I can help you. If you have questions that I don't quite get answered, I want you to just type the question in that section, and then I'll get to them as soon as I can. Now, I will tell you that a lot of times when you first start having hand pain, you want to look at how the muscle structure is. So are the muscles too tight in the forearm, and that causes pain into the hand? So you want to stretch those muscles. Just push back against the fingers, give a nice stretch. Don't forget the thumb. There's a way to do that like on a table or bed, but if you just stretch that and then exercise the hands in different directions, we have a list that we can kind of get together for you. By doing these exercises to strengthen the hand and to strengthen the arm while relaxing it, you can actually reduce a lot of pain. So start massaging the forearm and see if that doesn't reduce the pain. And if you notice that just massaging it or stretching it doesn't do it, then there may be a nerve problem. Now, when there's a nerve problem, that's when usually there's something out of line in the wrist here, and it's pinching the nerve, or it could be out of line in the elbow or the shoulder or even the neck. The majority of cases of carpal tunnel and some hand pains are actually caused from a double crush. In other words, a pinching of the nerve in the neck, weaken the hand, and then overuse then allows this to be pinched in the hand as well. So one pinch, two pinch, they call it a double crush or double pinch syndrome. And so if you have carpal tunnel or you're having hand pain, we need to do the carpal tunnel exam to find out what's going on. So we check 9 factors for neuromusculoskeletal problem. In other words, we check the nerve, we check the muscles, we check motion, we check on an x-ray to make sure that there's not arthritis or the space is proper in there. We also have nerve testing we do. There's no needles. I don't like the whole needle testing, but if we do the nerve test, and it's literally 99.9% accurate to find exactly where the problem is and how bad it is. It actually grades it on a scale. Now, I will tell you, if you're beyond 85% damage in the hands, then more than likely surgery is the only option you have. But I don't know about you. I'd like to avoid surgery at all costs if I can. So if you're less than 85% damage when we do the carpal tunnel or hand pain severity exam, then you're going to see great results. We have several therapies that we go through: electric therapies, physical therapies, motion therapies, strengthening therapies. Like, there's just a lot of different things that we do to get in there and re-strengthen the hands. So basically, that's what I'm going to recommend for you is get the hand pain severity exam. Find out how bad it is. Is it so far bad that you're not going to be able to help it? Or is it something that's pretty easy? It's just a nerve. Now, if it was a muscle thing, you stretching and working it would take care of it within 3 days. Now, if it takes longer, try a day or two maybe. But if it's longer than a week, I'm thinking it's not a muscle anymore. That's going to be a nerve issue. So if you've had a pain in your hand longer than a week, that should have healed if it was just a muscle. That's when I go, okay, now it's time to do something different. Get in there, check the nerves, check the neck, check the shoulder, check the elbow, and then check the hand and make sure which one's causing it. And from there, you can make a plan on how to get it better. There's always a way. So I want to encourage you, if you've been struggling, if you're hurting in your hands, you're having trouble typing at work, or even just throwing a ball or something, hanging out playing with the kids, then let's do whatever it takes to get you back on the right road again. Don't let it go and go and go until you need surgery. I've seen some people be fairly crippled up or even end up on disability because of the pain being left go. In other words, they didn't act, they didn't do anything, they didn't do what they needed to get it better, and then therefore they went more permanent. So I don't want to see that. I want to get you on the right road. So give the office a call today, ask for the carpal tunnel or hand pain severity exam, and tell them that you want to get in right away. We'll do the exam, we'll find out what's going on, and if there's anything that can be done, then we'll get started right away getting you out of hand pain. Stop the pain with no drugs, no surgery, no needles. So if you're interested in that, I want you to stop now. Give an office a phone call, 724 342-2225. I'd love to talk to you some more. And remember, leave a comment below. Say, hey, I have hand pain, or if you have a question, leave it in the comment section below. This is Dr. Tripp. I'll talk to you soon.